Hello, everyone. My name is Nurse Brennan from Medliant International Healthcare Staffing and the Adventurous Nurse Limited. I am your international nurse colleague and advocate here with you today to break down the different types of questions that you will see on the NCLEX-RN exam. The NCLEX-RN exam is the entry to practice exam for all registered nurses in the United States. Unlike many exams that you might be used to, the NCLEX is a computerized exam comprised of a variety of types of questions that you will see. Now, there's no way to predict what types of questions that you will get. However, if you get one question right, the next question will be more difficult. The same can be said if you get a question wrong. The next question will be easier. Your final grade is either pass or fail and is determined when the testing software is 95% satisfied that you've proven to be either above or below a specific threshold. You can write as little as 75 questions or as many as 145 questions. Now let's get into the types of questions that you will see on the NCLEX-RN exam. There are 7 different types of questions that you could see on the NCLEX exam. These include multiple choice, multiple response, hotspot, fill in the blank, audio, ordered response, or graphic. Now let's go find out what each one of these means. One of the most common types of questions that you will see are multiple choice questions. Now, the NCLEX will often start out with multiple choice questions consisting of 4 answers. Now, there are 3 components of these questions, and they include 1, the stem of the question, which will either relate to the client, a health need, scenario, or other important information needed to answer the question properly. Next, we have 3 distractors, and these can be incorrect answers that will try and trick you into believing that they could also be the correct answer, followed by, yes, the correct answer. Now let's take a look at an example. A patient is complaining of pain and a burning sensation surrounding the peripheral IV site where a potassium chloride infusion is currently running. A nurse who is not assigned to this patient immediately discovers that the peripheral IV has infiltrated. Which of the following actions should the nurse first take? A. Stop the infusion. B. Contact the physician. C. Inform the patient's nurse since this is not your patient. Or D. Aspirate any medication that may be remaining in the line. The correct answer is A. Stop the infusion. The first action the nurse should take is to stop the infusion to prevent any more medication from entering the patient and causing damage to surrounding tissues. The other answers are incorrect as you would contact the physician, but not until after you stop the infusion. You would also inform the patient's nurse. However, the patient's safety and care is the highest priority, and interventions to prevent further harm should not be delayed. And you would aspirate any medication that would be remaining in the IV line after the infusion has stopped. As we discussed, the obvious distractor is to eliminate C, contacting the patient's nurse since it is not your patient. As the intervention would not directly help to prevent further harm or alleviate pain or discomfort to the patient, this is not the first action that the nurse should take. The other 2 distractors, B and D, contacting the physician and aspirating medication from the line that might be remaining, could trick you into believing that these answers are correct, as they are interventions that you would perform. However, we must remember that the question is asking us what would we do first, and that of course would be to stop the infusion. Another common type of question that you will see are multiple response or select all that apply questions. Now, multiple response or select all that apply questions can have up to 6 answers to choose from, with as little as 1 correct answer and as many as 6 correct answers. The first step is to determine which of the 6 answers are correct and not just the best answers. One way to approach these questions is to treat each answer as either true or false. To get the question correct, you will need to successfully choose which of the answers are correct and which of the answers are incorrect. There are no partial marks for getting the question partially correct. Now let's take a look at an example. An ICU nurse is receiving a transfer from a surgery floor unit. The patient is a 42-year-old female suspected of having sepsis following a hiatus hernia repair, which was performed less than 36 hours prior. Which of the following symptoms might the nurse expect to see with a patient who is diagnosed with sepsis? Select all that apply. A. Fever. B. Fatigue. C. Bradycardia. D. Hypertension. E. Increased urine output. F. Altered level of consciousness. The correct answers are A, B, D, and F. Fever, fatigue, hypotension, and an altered level of consciousness are all common symptoms associated with sepsis. The other answers are incorrect, as patients with sepsis often have tachycardia to compensate for compromised circulation and perfusion and not bradycardia. And a decreased urine output is expected as kidney function is impaired and the patient becomes edematous. As we can see with this example, it is possible to choose if each answer is correct or incorrect using the true or false method for each one. The two incorrect answers are chosen as distractors because while they are incorrect, the heart rate and urine output are altered with patients who have sepsis and may trick you into believing that they could also be correct. A less common type of question that you may see are called hotspot questions. Now, hotspot questions include an image or table and are used to test your knowledge of key nursing concepts such as anatomy or physiology. Let's take a look. A nurse is caring for a cardiac patient on an adult floor unit. In report, the nurse was told that a murmur could be best auscultated over the mitral valve of the heart. Identify the area on the image where the nurse should auscultate heart sounds using their stethoscope to hear the mitral area. The correct answer is over the fifth intercostal space at the left midclavicular line, which is the best location to auscultate the mitral area using a stethoscope. Another less common type of question you may see on the NCLEX are fill-in-the-blank questions. These questions often use numerical answers for response, such as with a medication calculation. Yes, you will be given a calculator on your screen to use in the event that you will require one to answer a question. To answer this question properly, you are looking for milligrams per dose. So you will need to take the patient's weight, which is 19 kilograms, and times it into the safe dose range, which is 15 milligrams per kilogram per dose. By timesing 19 kilograms into 15 milligrams per kilogram per dose, you would then get 285 milligrams per dose. The last three uncommon types of questions that you may see on the NCLEX include audio, which requires the writer to listen to an audio clip and answer the questions accordingly, as well as ordered response, which requires the writer to rank the answers in a specific order, and lastly, graphic. The writer selects the correct graphic or image to answer the question. And some final NCLEX facts. To get your ATT or authorization to take the test, you will first contact your nursing regulatory body where you are licensed as a registered nurse. You will then contact Pearson VUE to register for the exam and then to schedule the exam, which can take place anywhere in the world. Common NCLEX question testing centers are located in the USA, Canada, Australia, UK, India, Philippines, Mexico, Puerto Rico, Taiwan, Hong Kong, Guam, Japan, and South Africa, among other places. And there is no limit on how many times you can write the NCLEX. If you would like to apply to become a Medliant USRN, please email your resume to nursebrennan@medliant.com. And remember, Medliant will reimburse the cost of your NCLEX exam once you begin working in the United States. My name is Nurse Brennan, your international nurse colleague and advocate, thanking you very much for taking part in this video today. I hope to see you here in the United States very soon.